Dr. Shawn, I'm really interested in the technology behind this. When a patient comes in, how do you plan for the technology behind the procedure?
So everything in this world has become digital, and finally, dentistry has followed suit. And so now we get to bring this into the digital world, and that's shortened the appointment time. It's shortened the amount of workload that we have to put on the patient to get this started.
Wow.
So all of our records are taken typically in about 10 to 15 minutes in the first appointment.
Really?
Everything we need. Mm-hmm.
That's incredible. So is it the same old days of like all the big things that have to get put in your mouth to get the x-rays, all of that kind of stuff, or is it different than that now?
The digital dentistry has totally done away with the goop and the difficulties and all of that, yes. It's made it so much easier for patients because we don't have to go through all these multiple appointments and we get to do things right up front.
Wow, that's incredible. Why does the experience you have matter so much in this process?
Because getting in the door is so difficult in the first place. We want to make sure that these patients are able to get themselves in the door, but then also we don't want to bog them down with all this difficult record gathering and information gathering and different things that really put a roadblock in this process for people. We want it to be fast and efficient and easy because it's not been easy to date with their dental journey.
Just super streamlined.
Yes, absolutely.
Start to finish. A lot of people have been told that they can't get implants because of bone loss and different issues. Is that still true?
It can be true, but it's generally not true.
Wow.
Most people have been told that by one dentist or another, and I think a lot of it has to do with the training and the available, skill sets that doctors have. This is something that requires a lot of additional training to get used to. Now, using angled implants and implants in other places of the bone, we've been able to pretty much get any patient in teeth. Can
you tell me, what do you mean by angled implant?
So an angled implant is just a way to use bone that's available. It's just getting smart with where we're placing implants. There's nothing complex about it. It's just knowing the anatomy of the human body and being able to work with it and make it possible.
Wow. Okay, so what about somebody that's been wearing dentures for years? Is that a candidate?
That's my favorite patient.
Really?
Yes, absolutely.
Tell me why.
Because I can change their life instantly. They've been wearing dentures, they already know the difficulties of wearing dentures, and they're ready for a change because they're so sick of everything that comes along with wearing dentures.
Wow, okay, great. So what about a medical condition? I've heard like diabetic may not be able to do this. Is that the case?
I think we put a lot of value on keeping our patients as safe as possible because at the end of the day, this is just teeth and we don't want to put you in a dangerous place, but most medical conditions can be worked around.